The other category of the medication is prescription medications. And even in the prescription medications, there are some which were used for other purposes and their side effect is causing sleepiness. So they're off-label use. For example, the most common of them is Trazodone, which
Mm.
is an antidepressant medication, but one of its side effects is causing sleepiness and or somnolence. So it is used sometime. I see a lot common in primary practices. Some of the APPs prescribe it, but the dose used for insomnia, trazodone dose, is much less than the used as an antidepressant. But again, it can have side effects. For example, daytime drowsiness and headaches. And then sometimes you have to go up on higher doses. So it's not FDA approved for this purpose, and it's not under any ASM guidelines. They don't endorse them. They're not strong evidence to support that they should be used only for insomnia purpose. But again, they're used. Then, for example, for Seroquel used for as an antipsychotic, one of the side effects is causing sleepiness, so it is commonly used in practice. Then there are medications which are purely made for insomnia. I forgot to talk about our most favorite benzodiazepines like
Yeah,
Lorazepam, Xanax.
Ambien. Like people ask about, can I get some ambience? Yeah.
So Ambien is a little bit different. Ambien is a non-diazepine, but it works on benzodiazepine receptors, and it is called non-Z drugs or Z drugs, non-benzodiazepine Z drug. Compared to pure benzodiazepines like Xanax or
Yeah.
Ativan, or Lorazepam or Mazepam, for example, these are less habit forming. They don't come without their own set of side effects. First thing we need to realize that these are Ambien, for example, or Lunesta are short acting. Unless even if you go to their XR releases, they're not very good for sleep maintenance insomnia for people who really keep waking up in the middle of the night unless they have no other issue that is causing that. For example, untreated sleep apnea. They're relatively safe medications. Like they don't suppress respiratory drive too much. So they're relatively safer for people with advanced lung disease, for example, compared to benzodiazepines,
Mm.
which are, I've never prescribed a benzodiazepine for insomnia. For short term, I would not say that Restoril you can't use it. For example, you have a patient in the hospital who's complaining of insomnia, and you can use for a day or two if they haven't slept. It is okay, but they're habit forming. They develop tolerance, so you have to go up on higher doses because they stop working at certain doses,